But to come back to the public health issue, I can't remember in my history as a physician where there was ever a regulatory body that was able to step in between a patient and a physician's confidentiality agreement. What we've seen happening now in the last few months is that the college believes that they have the full authority to make guidelines or recommendations, as they say it, and enforce that on physicians, accept them to follow them to the rule. And when there are physicians that legitimately say, but I know my patients. You don't know my patients. My patient hasn't complained at all. My patient is happy with the service and the treatment and the relationship that we've built on for years. Why would I change that? Because a new guideline came in place that still doesn't align medically or even scientifically with what I know about my patient.
I sat down with Dr. Rochagné Kilian, who has been one of the most significant figures in the COVID debacle. Dr. Kilian is an ER physician in Ontario who has recently come under fire by the CPSO, which is the College of Physicians and Surgeons of Ontario, for refusing to supply them with her patients' private medical information and their names. We discussed public health, medical ethics, the doctor-patient relationship, and the philosophical underpinnings of the COVID response. And that's beautiful. And this is, I think, what a lot of people have forgotten. There's been some disconnect that's happened, and it's kind of a spiritual problem. And I think that there's Matthias Desmet, in that chat, he was talking about how people are prone to this mass formation, like a mass hypnosis, if they have a lack of meaning in their life.
And that's why they're holding on so strongly. Apart from the effects of the hypnosis at this moment, they're actually holding on to it with intent, because once again, they've got a purpose in life. They're fighting this common enemy. Together. They're connected, not just through Facebook. They're connected in their communities. We're apart together. The irony in all of that. But they're doing it. It's tough. But you know what? We're doing this toughness together. They haven't gone through a war. Wars did bind people. The ones that were stuck at home bound them together because they went through it together. They went through the trenches, the social trenches together. And it bound them later on. This generation has not gone through that. They've gone through a lot of upheaval, but social, secular, humanist upheaval that they didn't even realize was carving away at what made them human, made them have that connection with people. We've been carving away from that forever, especially families, the way families function in today's time. The irony that we're in at this moment, though, because of the vaccine mandates again, how many families are being torn apart just by that. And that's the sad part at this moment as well. I speak to patients every single day that their families are torn apart. The other side of it as well, the families that are torn apart on this decision, the ones that are on the one side have to make that decision for themselves. We all have to make that decision for ourselves. But the ones that are stepping up in protection of either their own choice or their family or their children, they are also stepping into that choice with a lot of intent. So there's a lot of growth that's happening at this moment as well. People are waking up to the fact that, yes, before 2020, if you're not stuck in that hypnosis already, that yes, our life wasn't happy. We weren't joyful. We were rushing from home to work and rushing just to see each other during the week and maybe get to see each other over the weekends. So what they had before that wasn't good. Now they're starting to take that control back again, saying we value what we actually realized we lost during the pandemic. When you're stuck at home with a family member, which you almost never see, I think it opened up a lot of people's eyes for the good and for the bad. I think a lot of marriages didn't make it through the lockdowns, which is sad. But it also meant that marriages had cracks before, and it was easy just to forget about it because they were stuck on the rat race of life.
Because you could escape.
Exactly. The lockdowns made it that you couldn't escape. Physically, you couldn't escape your houses, you couldn't socially escape, but emotionally and as a family unit, you couldn't escape. You had to answer some hard questions and maybe have an introspective moment and look at yourself. I still believe a lot of people haven't reached that point, but the ones that have are going through so much change at this moment.
Yeah.
It's actually astonishing the amount of people you meet that put value in family now, put value in a hug. That's such a small thing. Out of our culture, we hug everybody. In fact, in our culture, we actually kiss everybody, like the Italians and those type of cultures. You get kissed on the cheeks. Exactly.
Québécois also.
Yes. And when that was taken away, even the handshake was taken away.
Yeah.
People realized it was such a small thing that we didn't even think about, that it meant anything. But it's what makes us human. We need that physical connection because there's something so much more underlining that spiritually. You don't even have to be a believer, but the consciousness of that human connection, you cannot deny that. And a lot of people can't, even after the lockdowns.
And you know, I think that this is why so many people are ethically opposed to what's going on and morally opposed, because what's essentially happened here is that you have the state, you have governments, you have bureaucrats, public health officials, politicians, literally rewriting the rules about social behavior, but to a degree that is completely unnatural. And so, of course, you're going to have this dissent because you're regulating human contact.
Mm-hmm. Yes.
And you're regulating also what we can see of people's faces and human expression.
Yes.
And so this is why there's just this immense pushback against the whole thing together. Because you could deal with parts of things, but when you look at things as a whole, it's basically an attack on principles, an attack on our way of natural life and social cohesion. And so this is completely unnatural. And so I think that for people who feel that way, you know, they can just take little steps to take back a little bit of that ownership, but without feeling guilty, without feeling like they did something wrong, that they broke the rules. But then at the same time, here's another thing, is that the taboo, breaking the rules, is also, you know, very tantalizing for people. So we've kind of seen in this separation of morality, you know, and of people down that dividing line that COVID mandates have created, that there are people who they're like, oh, this is taboo. Breaking the rule is really fun. And so I'll go secretly see my family. But then, you know, when I get to the grocery store and I see somebody not wearing a mask, who may have a valid reason, and that valid reason is their own thing. It could be a principled reason or it could be a medical thing, but I will lash out at them in some small way to flagellate for the COVID sins that I've committed.
Yes, I totally agree with you. Okay, and I think as an immigrant, obviously all immigrants have a lot of opinions on the country that they move to and the culture that they want to assimilate or not assimilate to. Because you need to do an assessment first of a culture and try to do an honest assessment of that culture before you decide to assimilate. So there's something about the Canadian culture, and obviously this is an average, or there's always exceptions to the rule. But there's a sense in the Canadian culture that values was based more on social posturing than really internal moral compass and internal drive to act in integrity. And it comes down with things like the mask wearing. You're absolutely correct. You either decided to wear that mask because you fully believe in this narrative, or you felt, but there's absolutely no scientific backing of these masks, so why would you wear it? Or you decide, yes, there is no backing, but I'm still going to wear it because I don't want to be seen as either different, or I don't want to be uncomfortable, I don't want to be confronted, because most people don't want to be confronted because they're afraid that when they're challenged, because the challenge comes before the confrontation, that if they're challenged, maybe they actually have to prove what they believe in, and that they're not really sure what they believe in yet. And that's the problem with social posturing. It's so easy to become defensive and going over into an attack. What we've been living the last 2 years with all the protests in the US, it's always a polarization of some or other subset of secular humanism. The theme changes every few months, but it's the same type of narrative where people are posturing and going over into activism. To what extent? Is it to make themselves feel better because they're standing up against something or standing up for something? But when you take it back to a personal, individual point of view, you use the mask wearing as an example. I can use my own story, my own experience. We never wore masks in the grocery store. And it was a huge risk as a physician that was employed during this whole pandemic. But if I honestly did not believe that masks were keeping people healthy, then I had the moral obligation not to wear a mask. I didn't have the choice. If I felt the conviction of treating this whole situation as an ethical dilemma, I could either put on the mask when I went grocery shopping just to be comfortable, or I had to take a step on saying, listen here, I know this is going to be uncomfortable. People can recognize me because obviously you're not wearing a mask. But I didn't have the luxury of not doing that because I knew it wasn't safe in the first place. The second part of it is, if the rules keep on changing around it, and I just keep on following the rules without questioning it. But there's an interesting thing that happened throughout this 2 years with the mask wearing as well. And it was also almost like a social experiment. Because we weren't wearing masks, you could see people's interactions. In the beginning, everybody put on their mask and they were happy to be out, at least to do grocery shopping. And you could see people still making eye contact wearing a mask. Then you see it developing into 2-3 months onwards. People made no contact. There was no eye contact anymore. There was no smiling. It got to the point that it was really not even fun to go grocery shopping, even if you were wearing a mask or not. I agree completely. And even now, it was, as a mom of 3-4 children now, it sometimes was a relief just to leave some of them at home and go grocery shopping. It's your moment of just walking through the aisles. But it came to the point that it was terrible. Because that human connection, there was such a vibe of defeat and depression. Actually, you could feel the people's depression. But what happened later on, then you could feel the anger towards you hostility. As a person. Yes, the hostility towards you. And then it became verbal at sometimes. Most of the time, people didn't have the confidence to say anything anyway, because that's just part of the Canadian culture. But you could feel their hostility. Then it started changing. Then people would just look at you and just look away and kind of in defeat. And the last few months, I can see when you walk into a shop with a mask, people are either shocked, but you can see the wheels turning in their mind, saying, "Is that even an option? I didn't even know it was an option for me." And you can see them making eye contact.
Yeah.
And when you smile, it's like they almost start standing up straighter, taller.
Yeah.
And like, oh my goodness, but why am I not making this decision for myself? Because I know I've read everything. I kind of believe this is not the way to do it. And how far have we come when we conformed to the mask wearing to where we are now with certain mandates?
Yeah.
You can see it turning, even if they don't want it. It's a natural reaction. And then what happens is people start taking off their masks. I cannot tell you how many times that has happened where people get the courage of doing the same thing. And once again, it's not about indoctrinating others or pushing your agenda on them. When you stand up with your own conviction, the people that actually believe the same thing but didn't have the courage to do that, they will step up because they don't feel alone anymore. Because that's what they've been doing this whole time, is to make us believe that we have a choice. That's the first illusion that they created. But the second one is that you are alone. And that is no longer the case. And luckily for alternative media and alternative social media platforms, otherwise we would still believe we were alone if you do not follow the mainstream narrative.
Yeah, that's a really good point. I've noticed that kind of experiment as well taking place. I've noticed a change. I went into the local cheese factory.
Yes.
And the lady there, she had, like a chin diaper, which shocked me. Yeah. I couldn't believe it. I said, yes, this is great. And but she still had it. It was kind of like a lazy chin diaper. So there was a bit over her mouth. But then when she saw my face, she just had a real chin diaper. Okay. Like it was all the way down there.
I thought you pulled it up.
No, that happens too. Yeah. Because, but it's crazy how, again, coming to the taboo, our faces have become taboo.
Yes.
And this is really a dangerous thing for our culture. You should be able to make choices for yourself. Yes. I understand that. What it comes down to at the end of the day is that individuals, I believe, should be in charge of the majority of things in their life.
Yes.
And again, what we're seeing here, to tie this back to public health, the response over the last year and a half, now these mandates that are tearing families apart on top of what's all of the pressure that's already been there. These are real strong division lines. With all of that together, what do you think is happening to the relationship between individual and physician? And why is the government, in form of public health, now in between that relationship? And how long has that been going on?
Oh, Kate, I think to understand the question of how long that's been going on, we need to make sure that the physicians are even willing to ask that question. Because if they are part of a corporation, healthcare, that's a very well set up business, and they think that they're independent, they think they're an independent contractor, they're not working for a company, but they're actually contractually agreed to pharmaceutical companies by the way that they practice, they're not even going to ask the question of how long have they been stepping up over their authority or over their jurisdictions, because you need to be willing to take a look at it. And that's what's been happening this 2 years. If you're not even willing to take a look and assess, you're not even going to realize that the fact you have to ask that question. I can't say, because I haven't been in family practice for a few years. I've been mainly emerged. So my responsibility was to the hospital. I work so that I get privileges to work, which is another thing. That's where a lot of the control comes in, is from hospitals as well, not just public health. But to come back to the public health issue, I can't remember in my history as a physician where there was ever a regulatory body that was able to step in between a patient and a physician's confidentiality agreement. What we've seen happening now in the last few months is that the college believes that they have the full authority to make guidelines or recommendations, as they say it, and enforce that on physicians, accept them to follow them to the rule. And when there are physicians that legitimately say, but I know my patients. You don't know my patients. My patient hasn't complained at all. My patient is happy with the service and the treatment and the relationship that we've built on for years. Why would I change that? Because a new guideline came in place that still doesn't align medically or even scientifically with what I know about my patient. And it comes down to, for example, the exemptions. If I had a relationship with my patient and I knew that patient's history and we were happy with that relationship, we made decisions together like physicians and patients should. It's not just a one-way street. It's a guidance. It's a give and take relationship. Otherwise, we're standing up in an authority and it's easy to abuse that authority as well.
Right.
So if that relationship is not on equal grounds, then we need to make sure that the respect was there. So, for example, if there's a good ethical physician that had the respect of their patients and they trusted them, they made decisions. Now the college believes that that is not the correct, proper way of doing things according to the guidelines that was put there by who? Public health and science roundtables. Then they are trying to step in between that relationship. And it seems like a trivial thing to happen, but I don't know if people realize the ethical implications of that. If that is the first thing that they're able to do is to step in between that confidentiality agreement, where are we going to end up? The first thing is maybe you don't get to get an exemption. Your physician doesn't decide, or you don't decide if you get an exemption. Where does it end up to the point of, do you get to decide if you're an organ donor? You see what I mean?
Right.
Ethical lines are important. They should be written in stone, not on sand, because it takes you down a pathway where sometimes you cannot return from. And that is where I'm afraid we're heading in that direction if we don't take on this battle now to protect that ethical lines and moral obligations, for example, between physicians and patients.
Well, it's the utilitarian question, correct? So you have basically this relationship that's supposed to be sacred, where you're supposed to be maybe authoritative as a doctor, but on equal grounds with your patient because it's their body, their choice.
Yes, exactly.
And then you have this authority here, which is actually the college or whatever regulatory bodies that different provinces and jurisdictions have.
Yes.
This is supposed to be there to make sure that this person doesn't abuse this person.
Exactly.
But instead you have this who's abusing both of these. So the patients and the the patients and the doctors are both being abused by the board who is supposed to ensure that no abuse happens.
Yes.
And so that's what we're seeing here.
Exactly.
And all for the reason of utilitarianism. So we are going to make these broad rules for everybody in the name of public health. But what's going to happen is that the individual is going to be trampled on.
Yes.
So I know a great example of this. There was a woman that I've become acquainted with who has numerous health problems, and she's has some kind of physical incapacities, and so she has a very shrunken lung, I think, and she literally cannot breathe properly with a mask on. She has a very legitimate mask exemption, and she has numerous other health problems that come along with her condition. And so when she showed up at one of these hospitals, they would not allow her in with this exemption. But it's like, what is the irony here that you're not able to seek medical care? And it was for a cardiogram, right? And it was something that was related to her underlying conditions. And so she was not able to do this because she was physically exempt. And so
she couldn't get this treatment or the service or even the diagnostics.
And she's a woman with disabilities who, all of the people who claim to protect the oppressed, the marginalized, the disabled, they say, well, we should be taking care of these people, but now these people don't matter anymore, and they've just become those people.
Exactly. And I think that's a very important part to make, because we need to understand the polarization that's happening. Polarization can only continue when there's two parties looking at each other and blaming the other side. But when we take that example, we need to realize there was a hospital administrator making those rules that was following public health. But there's also nurses and receptionists and security guards following those rules. So what has happened, what I could see happening in healthcare as well, just in the hospital, the implications of the mask wearing was the fact that there was no empathy anymore. There was no incentive to make decisions based on ethical, moral obligations. It was easy to just sit back and say, well, this is just the way it is, and I'm not going to take responsibility for my actions. And I think a lot of people's actions came out in this last year that probably that was the way they were always like, but it was easy to be whoever you wanted to be during this time period and use it as an excuse.
Well, maybe that's part of it. Maybe. But I think that also, the Stanford prison experiment, we were talking about that a little bit earlier as well, right? We just brushed the surface. But Philip Zimbardo, who conducted this experiment, basically was trying to show that the results of this experiment were also that institutionalized abuses would basically take your ordinary person and allow them to basically turn off that empathetic switch and become capable of great acts of evil that without the institution enabling abuse and condoning abuse and setting it up.
It's a self-generating system. It just needs a spark to get started. But in that institution, there's a self-generating energy that just continues. They don't have to keep that control. It just starts by itself.
Right.
And I could see it, just the lack of empathy. It was partly pandemic fatigue and burnout, yes, not because of the numbers, but just the society that we're living in. I mean, it's been a hard 2 years for everybody in every single part. But that disconnect from patients happened as well. And this did play a big role of it. If you're not able to connect with a person, able to see their smile, their little nuances in their face, there's so much of our communication that is lost. And that's the part that was hard for me, because we see a lot of psychiatry in the hospital. And you can't connect with a person if you can't see their face.
Right.
The psychiatrists, the counselors even said that. But the second part that was always the hardest was the little children brought into the hospital that a mask was put on their face. That's the first one. But the second part is they are stuck in a room now with their parents. Luckily, they've got their parents with them. I come in as a stranger wearing a mask. They can't even see my face and decide if they want to trust me or if they feel comfortable with me. So I always pull down my mask and smile at that little kid and reminded them I'm still a little human by here, and then I will pull it up. Otherwise, I will be fired because it's policy rules. But just that small little part of saying, what are we doing to our society with mundane rules that people don't realize how bad the implications can be of putting guidelines in if there's not proper thought and ethical guidelines behind it. And it brings me back to the Hippocratic Oath. I've heard a lot about the Hippocratic Oath in the last 2 years, and especially the irony, especially in the last few months, because people that are standing up in support of myself, that is standing up against the narrative, are saying, well, at least there's one physician following the Hippocratic Oath. The interesting thing is, I never took the Hippocratic Oath with very good intent. Because, interesting, and I don't know if maybe you knew this, but there's modern versions of the Hippocratic Oath, but there's the original Greek text. It's actually one of the most well-known Greek texts out there is the Hippocratic Oath. The Hippocratic Oath starts off by saying, I swear to the gods, Apollo, and a lot of the other gods. Once again, you need to know your history. So when I qualified as a physician, I did not take the oath. Not because I didn't feel like it, I was a rebel. I took it because I could. I didn't take it because I was a believer. My oath is to no other God than my God. But the beauty of that is, my God has put in rules that made it so that I could handle ethically as a physician and not have to recite a ritual at my graduation that would maybe keep me safe towards the public by being ethical. Because the problem with that is if you put your ethical and moral obligations outside of yourself and hand it over to an institution, that's exactly what we're living today. Yeah. What happens if the institution changes? The ones that you signed up with to support and to protect and defend and work with, what if their roots and their foundation changes? Where does that leave you as an ethical physician?
That's such a great point. That's, I was, in making a video one day, my partner and I were looking through some footage and we were looking for that recitation of the Hippocratic Oath. And we put it there in a video to kind of remind, the physicians actually, or whoever this video was directed towards, and the audience, that this is the oath that doctors take, right? And this is something that they do for those reasons. But it's interesting because what happens is you really just have this kind of drone where it's like the Charlie Brown voice coming over and just saying something that loses its meaning if it's not actually practiced. And that has to be practiced on a personal level. Yes, and this is, again, what we were talking about in our phone call about that God-sized hole. So when you have a society that no longer has any faith and doesn't have this personal relationship where their behavior in the eyes of God is important. Yes. And it doesn't have to be necessarily speaking to anybody who's agnostic or atheist. Yes. It's irrelevant. The principle is having this moral principle, kind of like somebody, you could even just be something else spiritually, but to know that your actions in the eyes of God, or however else you would like to call it, are more important than any other punishment. Exactly. It's basically your conscience.
Exactly. So the irony, once again, with the Hippocratic Oath, and I mean, when you've got nothing to expect out of a profession, having people say, at least remember the Hippocratic Oath is better than nothing. I agree with that. So reminding them of it. Yeah. But the irony of the Hippocratic Oath is that the first section of the original version, the first section makes the physician that's taking the oath promise to be loyal to the person that taught him medicine. So it wasn't first do no harm to the patient. Once again, the ironies in life, we keep on being surprised by the ironies if you don't know your history. Firstly, they would make a promise to say you're going to be loyal to the person that taught you. You'll make sure that their children are safe. And then you will make sure that you teach your children. So it was a mentorship thing, which was great because that is the way you should be learning. But in that same oath, you always also made a promise not to do abortions, not to do assisted deaths. So there's a lot of cultural things, ethical cultural things that come in there as well that was later changed. So it means it's the same thing. Once you bind yourself with man-made rules or guidelines, what happens when society changes? Do you have to change along, or do you keep what you were following when you started off with? I know the modern versions, and I did read that up in the last few days, there's some of the schools that don't even do it, and some of them follow it kind of religiously, but it's just a ritual. Nobody really believes in it. It's literally like throwing your cap after you graduated, that type of thing. Which also brings it down to the point, if you are stepping into a responsibility as a physician and you believe that you've got the responsibility as a healer, then you have a responsibility to really believe what is your ethical drive. Because there's patients going to step into your practice that puts you on a pedestal without reason, but that's just the way society has made physicians. But you've got a responsibility not to abuse that power as well. And the only thing that saves a human from abusing power is the fact that you believe in an entity bigger than you. Because we're all human. We're all fallible. We're all susceptible to human tendencies. And the more power you've got, the more responsibility. But it's also easy to be corrupted by power. We all know that. We've had good examples in our history when people started off good and they were corrupted. But if you keep your moral obligations to not to man, but to one entity that is infallible, then at least it maybe save you some heartache or other people heartache because of you. And that's the only oath that I've ever made in my life is towards him. And that is honestly, I think, what's keeping me afloat at this stage. I don't have to defend my college. I don't have to defend my university. I don't have to defend my Hippocratic oath or blame other physicians for not upholding it. Because I think we need to have a bigger obligation as a human race at this moment to step up in responsibility, which we haven't been doing for a long time either. When you say you're a person of faith, then you've got an extra responsibility. I expect more of you when you say that. If that's correct or not, who cares? That's just how the humans work. We're going to expect more of you if you say you're in faith. I did read something interesting recently where they say humans cannot kind of survive without a religion. And it doesn't matter what the religion is. I honestly believe the religion this last 2 years has been a faith in public health and a faith in science, the science. And the science
believe in science.
Exactly.
Believe in science.
That's exactly what it was said. It's like
this is the sentence, though.
It's stepping into a church.
But this is the sentence, right?
Yes. And believe in the science.
I believe in the science. I believe in the science. And then there are all those rituals.
Exactly.
You know, the hand sanitizer, wash your hands. And yeah, it is. And we were talking about this as well, about institutionalized religion versus personal faith.
Exactly.
And so a lot of the times people will make the argument that Christianity has so much blood on its hands. And so how can we consolidate those two things? Well, basically you have the institution.
Exactly.
And then you have personal faith. They're completely different things. And so therefore, when you see another institution, it's just another label. It's another type of corruption.
Exactly.
Of something that as it remains closer to the individual.
Yes.
Again, it's less corruptible. The further you get from that, the more you're moving towards the collective. This is, one thing that I believe we're seeing a lot as themes this year as well. We're raising our awareness over what is the rights of the individual and the rights of the collective.
Exactly.
And I believe that the closer we stay to the individual self-interest, individual rights, bodily autonomy, is the foundation for that.
Definitely.
And the further we can stay away from institutionalized abuses.
And that's what happens when you are putting your faith in institutions. There was something, this is a little bit of comedy. So I'm sometimes a bit, as I told you, I'm a bit of a Scorpion. So we've got a little bit of this going on, if we're all honest. So partway through last year, when people would ask me when I come into a shop, if I've got an exemption, and I said yes. And some of them ended up asking me what. I made up my own medical term. So I don't know if you want to hear this.
I want to hear it.
Okay. So my medical term for the exemption I had for not wearing a mask was idiopathic, fecal-fatal anaphylaxis. And that sounds very smart and very medical.
Beautiful.
The explanation for that is I have become in this last year, because this was last year I said this, I have become in the last few months deathly allergic to institutionalized bullshit. That's what it means.
I think that I need to have that written
down
and just kept in my pocket.
It will be in the medical dictionary coming out next year.
Well, that's beautiful.
But that's exactly what we're at that point where if you grew up a certain way, looking at institutions differently already, it was the last camel, the straw on the camel's back this last few years. And I think that is what's happening in our society at this moment, where people are tired of fighting against it and fighting for what we had before 2020, where they say, well, why are we fighting for that? Now we're going to step into the game, and now we're going to create alternatives. And we are going to be in control of that alternatives, not the institutions anymore. And that is, especially in the last 2 weeks, I've seen a shift happening with that regards. And that is the part that really makes me excited.
Yeah.
Because through all of this, none of us wants to be involved in a fight, fighting for something. We actually want to be involved in a fight, fighting for something better. And maybe we've got the luxury of seeing how it could go wrong to say, listen, maybe we can do it differently so that we do it better this way. Because for a long time, things were not done in the right way. In healthcare, in government, in so many different areas. But it was easy to forget about it because things still functioned. We could still just forget about it and continue with our lives. We all had the luxury of still just working, spending time with our family, watching Netflix every now and then. And then 2020 happened. It was put on everybody's radar that we all have decisions to make in this world. And I think you're exactly right on this point. The people that are stepping up, willing to say, I'm not going to wait to be marginalized and be segregated out of a society. I willingly step out of the society or the matrix that we were stuck in, and I decide to step out, and I am going to do it better. And I'm going to take up that responsibility and not wait for a government or a regulatory body or an institution to take up that responsibility, because each and every single person on this earth has a purpose here, a purpose of stewardship. Some people's kingdom, if you want to put it that way, is much bigger. Maybe it's just your purpose to take care of your family. That is still stewardship.
Right.
But it means that responsibility is not the church's, it's not the school boards, it is your responsibility. And the same thing with health. And that's the part that I think is going to be beautiful when we get through this. We can actually educate patients again on how to take responsibility for their own health.
You mean kind of in a parallel system of practicing medicine?
Exactly. Not the way it is at the moment, because as soon as you hand over the power to the patient, that hierarchy switches to such a point that business model no longer works the way we've got it at the moment. But if you step outside of that, that hierarchy turns around where it's a point of service towards humanity as a physician, but also it hands back the responsibility to the patient, which means your weight, your smoking, your drinking, your lack of exercise is not my responsibility as a physician. It is actually yours. So it means the reward is going to be so much greater, but the work that needs to be put in on each and every single patient is going to be greater as well.
Yes.
And nothing that comes with reward doesn't come with work to get there either. We've had cheap healthcare.
Right.
But we've had cheap healthcare.
Yes,
that's exactly what it comes down to.
Well, it's interesting. What you're saying here makes me think of a conversation that I had with Bruce, with Bruce Party. And he was basically saying, I'll link it below so that people can actually go see his exact paragraph where he spoke about this. But what he was saying was basically, we were talking about how some people are saying, well, the unvaccinated should no longer have access to healthcare. And he argued that, well, if you're going to go down that road, you should do it consistently. And so therefore it's like, okay, well then if you're unvaccinated, if you have a bad diet, if you don't exercise, if you ride a motorcycle, so all of these things that are associated with personal choice that increases or decreases your likelihood of chronic disease.
Exactly.
Well, then he said, if you continue down that path, what it brings you to is privatized healthcare.
Exactly.
And that's exactly what it is. So you can't have it two ways. You can't have this system where you have a public healthcare system where it's basically, it's a socialist system because it's equal for all,
yes.
To each according to his needs, basically. So I'm going to give you what you need. Everybody will pay equally, but you might have to suck up $100,000 on this visit. And the other person who never comes to see me because they have no need to come see me, well, then that's basically what the system is. And it's lauded and applauded in many countries. But here we see that now, if people are saying, well, we're not going to give to these people who have given their fair share because they've made a medical choice. They do not want to receive a vaccine and we don't want to give them healthcare. This hasn't happened yet, but people are talking about it, right? So, well, then you have to follow that down to its logical conclusion. Well, then you therefore have to do it for everything else as well.
Yeah, be consistent. Be consistent in all of that then.
Yeah.
But the problem is if you're not moving out of a place of either, I wouldn't say honest intent, but once again, ethical and moral obligations, you're not going to be consistent because it's once again just pushing a narrative. And the irony in that system that you just mentioned, it's about equality. But we need to realize with socialism and all of that, the equality is decided by who? Somebody that's not equal to the rest of the equal people. So it's not this group that decides on what is equally spread.
Yes.
It is somebody that's
a human being.
Exactly.
It's somebody who is playing God.
Exactly.
It's somebody who decides, I am smarter than you. I can decide what is best for the group. Well, who decides who the decider is?
Exactly.
And that's, again, the utilitarian question.
Exactly. And it's a religion because what it means is it puts that person once again into a power of playing God.
Yes.
If you don't realize it's a religion, it still makes it a religion because you're following it to the rule.
And that's where Carl Jung said that the state is a religion, basically, and especially in a culture that has lost God, that has lost its faith in God. So here you have, and now the state has wielded its priests of public health to basically calm down and cleanse the society of its lepers. This is literally what's happening. It sounds
very dramatic, but it's when you're living through it and you were on the front line, and especially from the beginning, because you read everything. You read the newsletters coming through, the emails from the hospital, from public health, because it's signed by public health officials through the hospital emails.
Right.
And you sit back and you're like, what has happened in this last year that we are at this point where there is so much power put into one department's hands?
Right.
And when you question them on it as a clinician, not coming from a public health perspective, coming from a clinician's perspective, then your questions are either just ignored or really attacked to the point, well, why are you not playing along? Why are you not part of the team now? Because it comes down to a team. The team also has to do what the manager of the team expects them to do. And if you don't fall part of that team, it's easy for them to just kick you off the season's team. Right. And that's exactly what's happened with physicians at this moment as well. And I've started asking the questions of what is public health officials training them? How is it so different from mine? Or how was it very similar before 2020, and now it's like we're reading different textbooks and different physiology, biochemical books. What has changed? Have I missed out so much in scientific innovation? Or is there another agenda behind the scenes?
Right. Well, here's the thing, is that I wouldn't even ask the question because we know that there are plans that are clear that we can find, from different organizations who basically talk about what they would like to do, and governments have signed up for this unanimous agenda, really, to vaccinate the majority of the population. They've bought all of these vaccines. They've decided they'll distribute all of these vaccines, and until they are taken by the quantity of people that they regard should take it, well, then they will continue to tighten and tighten and tighten the bolts on society until these people are effectively part of this regime. And you would have to ask yourself why. Like, why is it necessary if you have, apparently it's reported that somewhere above 80% of Canadians have received 1 or 2 doses of the vaccination.
Yes.
So then why is this happening then? Why do you need to essentially force the rest of the population to do this? Well, there could be, profit-based reasons for it. There could be also reasons down the line, such as if you would like for people to have this QR code, digital proof of vaccination, well, then this is a system that can then be used to do other things. And then they were saying, well, let's connect the driver's license to it and your health card to it. And if we've gone this far in less than 2 years in everything that we've seen so far, what else will be involved with this digital identity? Will it be possible that, for example, if you decide that you don't want to have a digital identity, will you no longer have access to drive your car?
Yes.
Will you no longer have access to a driver's license? Where do things end, and how far will the majority of people be tread upon wittingly?
And I think when we asked these type of questions 3 years ago, you were seen like the crazy person with your tin hat and conspiracy theorist. I honestly, the logical people asking the questions, it's not the crazies anymore.
No.
It's the people that is following the story that they are writing at this moment and coming to the same conclusions of where are we heading and what is the aim. The aim in the beginning was to flatten the curve. Then it changed, and then it kept on changing. And they stand back and say they don't take the responsibility for it because science changed. But how can you have faith in science when the narrative keeps on changing and your science keeps on changing?
Right.
But if your own scientists are now stepping out and saying it's not even just the science is changing, there's questions with your quality control and with your data that all of these decisions were made on, those are not the crazy people anymore either. So the ones asking the questions of where is this heading, that's the ones that are actually very logical and not emotional and not scared at this moment. Because we should be asking that. And if there is no truth to it, then it's fine. But everything is heading that way. Even if you just read mainstream media, you don't have to read alternative media to get these stories. It's the same, I think I quickly told you in the CP224 article, I think it was either on the NBC News, where they were discussing the vaccines with the children coming through. And it was still had to be taken through the FDA approval for it to go to the next hurdle to get the regulatory body on board or something like that. But in this article, they mentioned that we need to remember, we need to do the due diligence of having the process continue to have the safety and efficacy and all of that doing because it's children. It's even more important now. But the line directly underneath in the same article said, but Canada has already signed a deal with Pfizer for all of the vaccines for the children. So it comes down again to business. It's not a conspiracy theory. It's not an ethical question. It's who is making these business deals that impacts a whole country.
Right.
All of the population.
Right.
And if it is a business deal, and I think this came out in one of the parliament's speeches, I think it was the Romanian parliament. If it is a business deal, and this business deal directly affects me, and very soon possibly my children, why am I not privy to this business contract that was made with these corporations or countries? And we don't have access to it. Not even the politicians have access to any of the deals made with the pharmaceutical companies. Wow. And you don't need to be a conspiracy theory. You don't even have to believe that there's anything wrong at this moment. But having access to that information where it was taxpayers' money paying for these deals, we should have access to a business deal.
Now, this is funny because this also just discards the whole utilitarian concept of for the greater good. So we're not looking at this now. Like what we're being told is that these children should be vaccinated to protect their grandparents so they could go visit their grandparents. Now, we know that these children are at a highly increased risk of adverse events.
Yes, definitely.
And so basically they're being made sacrificial lambs.
Yep.
But we know now that it's not for the greater good. It's not for public health. Nope. It is for profits, and it is for implementing systems that allow a tighter grip in order to be able to basically do what you would see fit with a kind of system like that.
And the thing is, if this is just the start, where can this lead to if these type of business deals are not transparent?
Right.
Because maybe it was legit. Maybe it was a good contract with good intentions. Who knows? Right. We won't know because we don't have access to it. And as taxpayers, we should have access to deals that is made on our behalf.
Yeah, I think so as well, because we're paying for this.
Exactly.
We're paying for it, and we don't know.
Even though they say it's free.
And we don't know the ins and outs of it at all.
Exactly. And I think people realize in the last 2 years how much we are paying for this. Yeah.
So moving forward from here, what do you think we're going to see? You know, there's lots of predictions thrown out, but what do you think we're going to see in the next couple of months?
Out of a practical point of view, with the mandates setting in at this moment, I would be really, really worried as an administrator of a hospital or CEOs, because just losing a small part of your workforce because of mandates puts so much strain on a system that was buckling for years already. The system wasn't managing well, and now you take away some of that support. Nurses were overworked and understaffed and underpaid already, and now you take a big part of that away. The winter that's coming, I don't know if it's going to be an easy winter for the medical system itself and for people in general. Once you start messing on a global economic scale and a supply chain scale, the implications are going to come. It doesn't matter if it's in a week from now or 2 months from now. I do believe we're probably still going to maybe go through a hard winter. But I want to have the faith in knowing that we're going to get through this. There might be casualties, because in all battles, there are casualties on both sides. And the end of it is maybe we get to have a better society after this. But anything that has made a change in society, you had to fight for it. When you look in history, nothing ever came for free or came easily. And if we just look at how much power institutions and governments and regulatory bodies have gained in this 2 years, taking some of that power back and then more, deciding that we want to be in control, there's still a hard battle ahead of us. And if we don't keep that mission in line, it's easy for anybody standing up against this to get tired. Because if it's for personal reasons and personal gains, the battle is definitely not worth it. But if it's on the greater scale and brings us for the greater good, the irony, if you're fighting at this moment for the greater good, you don't have the luxury of stepping back anymore. We've got too much to lose. We both have children. We know what it means to fight and to continue fighting for this. But we're going to have to fight harder than what we've been fighting till now. Because if we don't fight actively, and I don't mean physically fight, I mean standing up and not in what is the word, unified nonconformity. If we don't actively start taking that role, we just lose ground. Because if you stand your ground, but the push is so big, then you still get pushed back if you don't start pushing in the different direction. So I do believe we still have a battle ahead of us.
Now, I think, and I would like to know your opinion on this thought, I think that the individual choices that we make are the way to fight back.
Yes.
If we want to use those terms.
Yes.
Because collective action is one thing, but that takes, I think in this case, the sum of individual action. Yes. And it's a really tough distinction to make sometimes, but really what we're seeing is, I think collective action usually comes from the top. That's how I view the differences. I think community and is individuals coming together. Yes. So we can do things as groups of people, but I think that this is something that will have to begin in our own households.
I totally agree with you. And it comes down again to that internal obligation that you feel. And I asked this question at a rally or a freedom gathering last week, where it doesn't matter what the regulatory body says or what the physicians say. If you want to ask the parents regarding the vaccine mandates, that's where the questions start and that's where the questions end.
Right.
Because they're the only ones that have a choice in this matter at this stage.
Yes.
Not the FDA, not the CDC.
Well, the state is starting to take those choices from certain parents, though, in different custody cases and things like that as well. So
unfortunately,
I think we need to be very wary of that. And anybody who's not drawn a line in the sand and who may be listening to this, it may be a good time to consider doing that, because that is where we will get the sum of the individual choices.
Exactly.
It rolls out that way. It has to be organic. It has to be a shift in the culture.
Exactly.
And it has to be from the ground up. It can't come from the top down.
Totally
That's
agree.
been the total problem.
Totally agree. And that's grassroots movements. That is the only thing that makes a difference culturally in the society. That is what shifts history, is when it starts from students, families, communities. And we can see that happening in the community that I'm from. It's becoming so natural. It is like somebody set fire and it's just growing on its own. You don't need to push it in any way.
Right.
And people have the motivation, but I honestly feel like in the last few weeks, we've reached the point where it's now gaining its own momentum and people are being motivated by that because they have at least something to work towards, even if it's just connecting with another person in a park, to get to know each other before we're stuck in our homes in winter anyway because of Canadian weather. But it is going to start with a person first. And before you make a decision on anything anyway, as a logical, ethical person, you need to go and sit down and say, what do I believe? So just out of that point of view, getting people to the point of looking internally to say, how do I fit into this world? What do I believe? Have I ever asked myself that question? Because you need to ask yourself that question first before you decide what you're willing to fight for. Otherwise, you can be manipulated in any way, anyway. Then it's no different than the institutions and what's happening at this moment. Because then you can be used as a mob on the other side as well. But having that internal drive and motivator is what maybe saves us in this battle. Who knows?
You know, we're only a dot in the universe if we believe we're a dot in the universe.
Exactly.
Because it has a double meaning, right?
Exactly.
I mean, you're a small part of things, but you are part of things. Every single minor thing can be a major change. And we've seen that in many historical examples.
Exactly.
You look at these small actions that sometimes just light the spark. And we're seeing that all over. So thank you so much for being here.
Thank you, Kate.
And this has been a lovely conversation that will certainly continue once the cameras have stopped
Definitely.
rolling.
We'll probably never go to bed. That's the problem.
I think that's what's going to happen. So it's going to be a lot more to explore. And thank you for being here for this audience as well.
Thank you.
And I'm sure that we'll have more that they will hear from you in the future as well. So
I'm not ready to give up the fight yet. So absolutely.
Wonderful.
Thank you, Kate.
Thank you so much.